Hi everybody, my name is Carl Bonnet. I'm the founder and medical director of Clarisana. And I want to make a quick video talking about the recent CNN story about ketamine for severe depression. First of all, I think it's awesome. I would applaud the folks at CNN and Dr. Gupta for going ahead and making that piece. I know we've reached out to them several times over the last couple of years trying to get them to cover ketamine and talk about what it can do for severe depression. So that's great that they've finally gone ahead and done so. So please take a look down below. We have the link for that video, so you can take a look at the actual CNN piece and see what they have to say. There's a couple things I think are worth pointing out from that video that are pretty important. One of which is the physician that got interviewed made a very poignant statement talking about how the experience, the dissociative experience of the ketamine, is actually a really important part of how it works. That's something that we've talked about quite a bit. You can take a look at some of our other videos that go into a lot more detail about the psychotropic therapeutic response and the experiential component of ketamine. So I think it's much more than just a biochemical reaction. The transpersonal experience that you get with ketamine, the change in your perspective that you get with ketamine, is not at all a side effect, but actually a part of the therapy. So that's an important thing I'd like to kind of emphasize. And it's also important to consider later on this fall when S-ketamine comes out. It'll be a nasal spray that's slightly modified from regular ketamine and whatnot, but they won't have any of that experiential component because, again, this is a very disruptive medication, very disruptive therapy. So the idea that the experiential component of a medicine, that the quote-unquote psychedelic aspect of it can be therapeutic is huge. And I realize this is incredibly disruptive. So that'd be the one thing, caveat I'd throw in there as well. And then the other thing that I think is important to point out is that the interview, the story goes into a lot of detail saying that, it can decrease suicidality in hours. Well, there's some truth to that. There's some evidence to that. There's a couple studies showing that it can decrease suicidality in real time, but that's a little bit disingenuous. I think that's setting people up for failure. The usual treatment course with ketamine is a series of 6 infusions that we call the induction series. And if you start getting the mindset that everything should change in the course of 1 infusion, you're really going to be setting yourself up for disappointment. That's really not what we find. Usually it's after about 3 infusions that people start to get a little bit of improvement, and then for 70 to 80% of people, it's really over the course of the 6 infusions that the maximum benefit is obtained. So that would be the one thing I'd like to just have people take with a little bit of a grain of salt, that they really emphasize the idea that everything can get better in a few hours. So anyway, check out their video, check out some of our other videos, and if you have any questions about Clarisana, you want to learn more about ketamine infusion therapy, check out our website at clarisana.com, or feel free to contact us. Thanks very much.